Well, certainly one story that I think of that was recently in the news is Brian Steinhauer, who's a patient that we took care of at Mount Sinai. And a classic case of someone who comes in with a very severe injury, but has so many good things that help him to get better. He was a very bright fellow, just in general, was an honor student at Binghamton University, had a great supportive family. And I think when we talk about family support, he's a classic example of his family being such a strong advocate for him and helping him transition from the acute care into acute rehabilitation at Mount Sinai, and then making sure that he gets all the appropriate outpatient treatments for him. So he's someone who came into us really in a coma and having been severely injured, and he was a couple of months post-injury. And after being at Mount Sinai, walks out of Mount Sinai, certainly 4 or 5 months later, but successfully walks out of Mount Sinai and is now really living, with his parents, but really living so independently, traveling all around New York City on the subways independently, looking forward to getting a job for himself, trying to return to all the things that he had before. But the things that really, as a classic example, is he comes in, he's a bright fellow, he's got all these good things behind him, so he comes in with good substance and has this very supportive family, gets the best of therapies, and it's certainly happy to see such a good outcome. Just in general, just seeing him a couple of days ago, he's enjoying all the things that you'd want someone who's 22 years old to be enjoying.